I'm Marinda Nelson, training the leaders of the brilliant new era in healthcare, develop and lead the fun and fulfilling, prosperous and profitable practice of their dreams. What I do. This is what I do. And I do this based on years of applied being in practices, doing these things, doing it this way, going back, learning all of the spiritual practice and all of the pre work, the awareness, the confidence, the clarity, the authenticity, the owning your dreams, getting clear on what you want, feeling it, developing the steps and the physical practice and embodiment of it, and then allowing our spiritual self, our intuitive self, our inner knowing to bring us those urges and those nudges that then we can act upon to bring that practice into being. We are taught. We see it's romanticized, it's glorified, it's all over socials that healthcare and leading and managing is a headache, that it's stressful, that it's not fun, that it's burnout, that it's imposter syndrome. We hear about all of these things. And or that if you have fun and you do it authentically and you do it really connecting with your people, that there's just so much coming at you and that that's just not the way that you can do it and that it's not going to be prosperous or profitable. And I call bullshit because when you really get to doing it this way, when you get deeply clear on like crystal clear on the practice it is that you are developing and how you want that to feel. And you get it just so you just know. You just know that I got this and we're gonna figure this out and that there's a way to do this before you see it done. But you know that this is what you're here for. This is what you're developing. This is what you're bringing into being. Hands down, no matter what, no matter how long it takes to get there, I'm doing it. I own it. This is the dream that I'm going to create. This is what I'm going to bring into being. We're going to do it this way. And however long that takes is however long it takes. And you're willing to get creative and to see new ways of doing it and to listen to new voices and to listen to you and to believe in you and to do the crazy thing that makes no sense, they say. That's so often the thing to do. And you're willing to fight for it. You're willing to take a stand and say, hey, this is what I believe in. And those things matter and definitely do that. And there are also ways really own what it is you dream of and create the resources to provide for and protect your dream, your desires, your full expression, your way of being. And that is your dream practice. Now, some of us may choose to house them in corporate systems. We may choose to host them in nonprofit systems. We may choose to go out on our own and do our own practice. We may choose to stay where we are. We may choose to move. We may choose to go online to somebody's talked something about Peace Square the other day. There's so many different opportunities, collaborations out there that when we get so focused in on this thing or that thing, we miss, we have these blinders on and we miss all of these other opportunities. There are opportunities out there. There are ways to get creative out there where you can truly say, okay, you know what? This, I want to feel this way and I want to feel this way and I want to bring this into being with it and I want to bring that into being with it. And then there may be some part of you that says, no, it doesn't get to be fun and fulfilling and prosperous and profitable. But you say, you know what? It's going to. I'm going to figure out a way. We're going to develop a way that it gets to be. I've talked about the adrenaline junkie and super high end. It gets to be dermatology and farmers in the central US. It gets to be whatever the things that are important to you. And often it is the thing you're not supposed to be. You're not supposed to be so casual with your patients. You're not supposed to be so professional. You're not supposed to be so focused on, you're not supposed to be such a bitch. You're not supposed to be wear black all the time. You're not supposed to be in the muck as a doctor. You're not supposed to, whatever your thing is that you're not supposed to be, that you've heard forever. You're not supposed to be so high maintenance. That was one of mine. You're not supposed to be such a fast talker. You should be more organized. You should be more professional. You shouldn't swear. You should, whatever your things are, know that what you're not supposed to be is probably your specialty. Because if you are that enough that people feel the need all the time to comment on it, to try to settle it down, to try to have you not being that, like if it's something that people comment on that often, you are that. And by trying to suppress that, by putting judgment against it and against you, then you're missing out on this huge opportunity of who you are and what you get to bring into being. There are people looking exactly for you. Now, I specialize in working with those in the central US. So I'm from Minnesota, Wisconsin. I lived in Colorado for many years. I live now in New Mexico. And there's this corridor of the US that people don't kind of specialize, right? We go to the coast and there's all of these big cities there and these big trainers that come out of there, but they don't know and don't have the awareness for what it's like saying, yeah, you get to do it your way when they're in a community of 3 million people. It's a very different awareness to have, realizing that people are in communities of 3,000 or 13,000 or 30,000, 300. Right. And so this idea, the fears behind being yourself and doing it your way are very real. Right? The idea that that one administrator, that one boss, that one whatever doesn't like you seems like life and death for your practice. Crying in that one administrator's office because we've all done it because we're the ones that care. And we get so frustrated that they can't just see that it could be so much better, so easy. You just like, ugh, it's just like a stab to the heart when they just don't see it. They just don't get it, but they don't. And that's why we are the leaders. We need to be the leaders. We see it a new way. We understand it a new way. We get it a new way. It can be so much better. It is the brilliant new era coming. Yes, this old one is collapsing. It's falling apart because insecure leader had to bring in less qualified and more insecure leaders had to bring in less qualified and more insecure leaders. And you are going to flip this on your head, on its head and bring in better and even more secure and better and even more creative and more caring and more compassionate. And we're going to own that. We're going to own it. This is the brilliant new era in healthcare where it is about the individual human. We've had this incredible many years where it's been about the technology and it's been about efficiencies and it's been about getting norms and we needed those numbers to like, hey, what can this way of doing it do? And what can this technology do and how can it help us? And that's led to incredible advances in diagnostics and treatments. And that's incredible. And now it's time about the human again. And you, as the providers, you are the beginning. You don't really think of yourself as leaders a lot of the time because you're not the practice administrator, the hospital corporate this, or the CEO, C suite that, but you are the leaders. It is your practice, whether you, like I said, chose to house it in a corporate system for them to support you, for them to support you. Let me say that again, for them to support you, not constrict you. That is one of the core concepts. There is a foundation to be built in relationships. There is understanding that systems and structures support you, not constrict you. And then there is this piece of authenticity, which is providing for and protecting the space for you to truly own and bring into being and express your dreams, your values, and your fullest expression. That is leading your dream practice. Leading your dream practice then is awareness, having awareness for what's going on around you. You have that, you do that. You need to trust that. Leading by example, you do that. Trust that. Continue doing that. Training. This is everything from those like 30 minutes, how you answer a question, or 30 seconds. I said 30 minutes. Cute if you had 30 minutes in corporate training planned, right? That you can create and develop that space for you and for your team. And it often begins with how you answer a question. That's training, valuing what you value. So that's leading by example, but also this goes over into training then. Empowering and encouraging, those are separate, very important things. And then redirecting when it's necessary to redirect. Now, this is you, this is your colleagues, and this is your staff. And I know it seems like when you are housed in a corporate system that they have taken so much of that from you. And yes, some of it's supportive, and yes, some of it's really frustrating. And there are creative ways that you're not thinking about, that you're not seeing, that it still can be done. I know it feels like you're alone. I know it feels like you're the only one that gets it this way. I know it gets to feeling like it can be so frustrating because it seems like these super simple, just like, how do you not get it things? And we think that we're normal and that they just don't get it. But what you don't realize is that you are the one that's distinctly, incredibly amazing. You are the one that's meant to be the leader. You are the one that's doing things better. You're not the imposter thinking that you should take a leadership role. People follow you naturally, or they get intimidated by you and then they reject you. They both happen. You are the leaders of this brilliant new era. You're not alone.